القادم.
Good afternoon. I am Shimaa Abdelsattar, Professor of Radiology, Pediatric Radiology Section at Ain Shams University. And I'd like to thank Professor Dr. Yassine for inviting me to this wonderful session and insightful session. Today, we will explore the role of artificial intelligence in pediatric imaging, focusing on unique challenges, opportunities, and our own local experience at the pediatric hospital. Pediatric imaging, as we all know, is fundamental in diagnosing and managing a wide spectrum of childhood conditions, ranging from congenital anomalies to infectious diseases to malignancies. But as many of you know, interpreting pediatric imaging is not the same as adult imaging. This is where artificial intelligence promises to support us as radiologists and not replace us, as Dr. Aya said. The promise of AI has the potential to address many challenges, improving diagnostic accuracy, efficiency, and patient outcome, and it enhances image quality, reduce radiation exposure, as we have just seen in the previous presentations. There are unique challenges in pediatric imaging, starting from anatomical and physiological variability. As we can see here, this normal thymus has a variable shape in 3 different infants. Also, skin fold may be a bit full for non-expert radiologists, and in this AI can help in this situation. Also, as we know, brain MRI has a variable appearance of signal intensity in different ages. This is an infant brain, has a bright, hyper-intense white matter. However, in adult brain, the white matter is dark. Also, the musculoskeletal has a wide variability across ages. We can see swelling in the left knee in the case of septic arthritis. This is a case of congenital short tibia. So there are a wide spectrum of normal variations and congenital anomalies and diseases. Also, children are more sensitive to ionizing radiation, necessitating careful dose adjustment while maintaining imaging quality. Young children may have difficulty in remaining still during imaging procedures, leading to motion artifacts that degrade image quality. So strategies for reducing sedation and developing child-friendly imaging protocols are very essential to improving the imaging experience for pediatric patients. Also, there are a scarcity of annotated data sets for rare pediatric conditions, makes it challenging to train robust AI models. However, there are many technologies in AI, as machine learning and deep learning. Convolutional neural networks are key to image analysis, classification, or segmentation in complex pediatric cases. Also, computer vision able tumor segmentation and detection of subtle abnormalities as fractures or subtle diseases. Also, natural language processing is crucial for extracting valuable insights from unstructured data, like clinical notes and radiology reports. This technology allows us to integrate a patient's complete history and imaging findings for a truly comprehensive analysis. AI has a promising impact across all pediatric imaging subspecialties in oncology, as in tumor segmentation and tumor detection, in musculoskeletal detection of fractures and tumors, also and congenital anomalies, in children with epilepsy and or appendicitis, interception, also in cardiac imaging, in diagnosing cardiomyopathies and analyzing ECGs and cardiac MRI. The key benefits of AI, as all said in the previous presentations, improving diagnostic accuracy, reducing lesion exposure, and enhancing efficiency. Also, personalized medicine for optimized treatment plans by predicting patient responses to specific therapies, tailoring care to individual patients. There is early experience in pediatric radiology section at Shams University by two projects, a deep learning segmentation model of neuroblastoma, and we here have our collaborators from Cairo University. We segmented neuroblastoma cases with a DICE score approaching 0.94. DICE score is a critical metric for evaluating the performance of segmentation models. It measures the overlapping area between the ground truth, which is the expert radiologist, and the model prediction, and approaching 0.94 in our series. Also, we have used the LONET Insight for interpreting pediatric ICU in patients, chest X-ray in pediatric ICU patients. This is a case of a pneumothorax. We can see the color map of the finding here. Another case with sudden pneumothorax here, and the AI is perfectly predicting this abnormality. Also, we can compare the resident performance without the use of AI, and with the use of AI, we found that marked increase in sensitivity in lesion detection, also approaching the expert radiologist. And these early steps demonstrate the real-world impact AI can have in pediatric imaging. Continued research and collaboration will be crucial to fully realize AI potential in ensuring better outcomes for our pediatric patients. And these are references for further reading. And certain slides, I would like to acknowledge AI, as certain slides were generated by the support VI tools, Manus and Gamma. These tools were used wisely to complement and not replace critical thinking and subject expertise. At Ain Shams, we are committed to continued research and collaboration in this field by the head, Dr. Ayasin. And thank you very much. And this slide is originated by ChatGPT also.